Welcome to all. Myself Sajithra, lecturer of Emmanuel Arasar College of Pharmacy. Today in this session we saw about the antibiotics. First of all, what is an antibiotic? Antibiotic is a form of antibiosis. Antibiosis means against the life. The substance derived from a microorganism or produced synthetically to kill or suppress the growth of other microorganisms is known as antibiotics. Classification of antibiotics. The antibiotics are classified into three main classes. They are on the basis of mechanism of action, on the basis of spectrum of activity, and on the basis of mode of action. First, we see about mechanism of action. Mechanism of action of antimicrobials. First mechanism of action is inhibition of cell wall synthesis. Example for this classification is penicillin, cephalosporin, vancomycin, etc. Then inhibition of function of cellular membrane. Example for this classification is polymyxins. Third one, inhibition of protein synthesis. Example for this classification is chloramphenicol, macrolides, clindamycin, tetracyclines, aminoglycosides, etc. Fourth one, inhibition of nucleic acid synthesis. Example for this classification is quinolones, rifampicin. Third one, inhibition of folic acid synthesis. Example for this classification is sulfonamides and trimethoprim. And then on the basis of mechanism of action. First of all, the mechanism of action is based on cell wall synthesis inhibition or nucleic acid synthesis inhibition or protein synthesis inhibition. In this classification, the drugs are classified as beta-lactamase inhibitors, cell membrane inhibitors, 30S ribosome subunit inhibitors, 50S subunit inhibitors, RNA polymerase inhibitors, and DNA gyrase inhibitor, and finally, folate synthesis inhibitor. Example for beta-lactamase are penicillin, cephalosporin, carbapenems, monobactams, etc. Example for cell membrane synthesis inhibitors are polymyxins. Example for 30S subunit synthesis inhibitors are tetracycline, aminoglycosides, etc. Example for DNA gyrase inhibitors are quinolones. Example for RNA polymerase inhibitors are rifampin. And example for folate synthesis inhibitors are sulfonamides and trimethoprim. Antimicrobial spectrum. Antimicrobial spectrum are classified into two main categories. They are nanospectrum antibiotics and broad spectrum antibiotics. First of all, what is antimicrobial spectrum? The drug kills or suppresses the growth of microorganism is known as antimicrobial spectrum. And narrow spectrum means the drugs that only act on only one kind or one strain of bacteria is known as narrow spectrum antibiotics. And then broad spectrum antibiotic means the drugs that have a wide antimicrobial scope, which is known as broad spectrum antibiotics. Example for narrow spectrum antibiotics are isoniazid. Example for broad spectrum antibiotics are tetracycline, chloramphenicol, etc. On the basis of mode of action, the antibiotics are classified into two main categories. They are bacteriostatic antibiotics and bactericidal antibiotics. Example for bacteriostatic antibiotics are tetracycline, chloramphenicol, lincomycin, etc. Example for bactericidal antibiotics are cephalosporin, penicillin, aminoglycosides, etc. Misuse of antibiotics. Antibiotic misuse, sometimes called as antibiotic abuse or antibiotic overuse. The misuse or overuse of antibiotics may produce serious effects on health. It is a contributing factor to the creation of multi-drug resistant bacteria, informally called as superbugs. Antibiotic resistance and cross resistance. Antibiotic resistance is the phenomena that's susceptibility of pathogenic microorganisms to antibiotics because lower or even lost after the microorganism contact with antibiotic many times. When the bacteria show resistance to one antibiotic, they are also resistant to some other antibiotic. This phenomenon is called as cross antibiotic resistance. Mechanism of antibiotic resistance. First one, alteration of the target site of the antibiotic. One of the most problematic antibiotic resistance worldwide, methicillin resistance among Staphylococcus species. Second one, enzyme inactivation of the antibiotics. Beta-lactam antibiotics such as penicillin and cephalosporin can be inactivated by beta-lactamase. Third one, active transport of the antibiotic out of the bacterial cell. Active transport of the antibiotic out of the bacterial cell as removal of some antibiotics, example tetracyclines, macrolides, and quinolones. Fourth one, decreased permeability of the bacterial cell wall to the antibiotic. Alteration in the porine proteins that form channels in the cell wall membrane. Example, resistance of Pseudomonas to the variety of penicillins and cephalosporins. And then principle, that is general principle of antimicrobial therapy. Identification of the infecting organisms should precede the antimicrobial therapy when possible. The pathogenic microorganism susceptibility to the antimicrobial agent should be determined if a suitable test exists. Factors that influence the choice of an antimicrobial agent or its doses for a patient include the age, renal or hepatic functions, pregnancy status, and site of infections, etc. Selection of antimicrobial agents. First one, embryonic therapy. Prior to identification of organism, critical ill patients. Second one, organisms susceptibility to the antibiotics. Third one, patient factors such as immune system, hepatic or renal function, etc. Effect of site of infection on therapy, blood-brain barrier, safety of the agent, cost of the therapy. And then ideal antimicrobial agents have highly selective toxicity to the pathogenic microorganisms in host body, have no or less toxicity to the host, and then low for the development of resistance, not induced hypersensitivity reaction in the host, have rapid and extensive tissue distribution, be free of interaction with other drugs, be relatively inexpensive. These are the ideal properties of antimicrobial agents. Complication of antibiotic therapy. Resistance due to inappropriate use of antibiotics. And next complication is hypersensitivity. This hypersensitivity most commonly seen in penicillin. Direct toxicity, which means aminoglycosides produce ototoxicity. It is the direct toxicity. Superinfections. These four are the complications of antibiotic therapy. Antimicrobial combinations. The result of combination therapy are first one is additive effect. The activity of two drugs in combination is equal to the sum of their independent activity when studied separately. Second one, synergistic effect. The activity of two drugs in combination is greater to the sum of their independent activity when studied separately. Antagonistic effect. The activity of two drugs in combination is less to the sum of their independent activity when studied separately. Indication for the clinical use of antimicrobial combination. First one, prevention of the emergence of a resistant organism. Second one, polymicrobial infection. And third one, initial therapy, decreased toxicity and synergism. Prevention of the emergence of resistant organism. Decreased resistance Mycobacterium tuberculosis with combination. Reduction of beta-lactamase induction with combination of beta-lactamase agent and aminoglycosides. Polymicrobial infection. Intra-abdominal infections, pelvic infection, mixed aerobic and anaerobic organisms. Initial therapy. In initial therapy, the patients where the nature of infection is not clearly identified. Decreased toxicity. Decrease the toxicity of the drug required for treatment and thus reduce the dose-related toxicity. Synergism. Enhanced uptake of aminoglycosides when combined with beta-lactamase agents. First one, treatment of enterococcal endocarditis. Example, ampicillin and gentamicin. Treatment of Pseudomonas infection. Example, beta-lactamase agent and aminoglycosides. Inhibition of sequential steps. Sulfonamide with trimethoprim. Treatment and prevention of chronic urinary tract infection, typhoid fever caused by organism resistance to ampicillin. Inhibition of enzymatic activation. Disadvantages of the inappropriate use of antimicrobial combinations. Antagonism, increased cost, adverse effect, superinfections. These are the common disadvantages when seen in the antimicrobial combination usage. Then classes of antibiotics. First one, beta-lactamase. Example for beta-lactamase are penicillin, cephalosporin, carbapenems, and monobactams. Second one, macrolides. Third one, aminoglycosides. Fourth one, fluoroquinolones. And finally, tetracyclines. These are the classes of antibiotics. Penicillin. The penicillin are the oldest class of antibiotics. Penicillin have a common chemical structure which they share with cephalosporins. Penicillins are generally bactericidal, inhibiting formation of the cell wall. Penicillin are used to treat skin infections, dental infections, ear infections, respiratory tract infections, urinary tract infections, etc. Types of penicillin. First one, the natural penicillins. Example for natural penicillin is penicillin G. Second one, penicillinase resistant penicillin. Example, methicillin. Aminopenicillin. Example, ampicillin, amoxicillin. Penicillin side effects. Diarrhea, nausea, vomiting, and upset stomach are the common side effects of penicillin. In rare cases, penicillin can cause immediate and delayed allergic reactions such as skin rashes, fever, etc. Penicillin are classed as category B during pregnancy. Then cephalosporin. Cephalosporin have a mechanism of action identically to that of penicillin. Interference with synthesis of the bacterial cell wall and so are bactericidal. Cephalosporins are used to treat pneumonia, streptococcus, and some infections such as urinary tract infection, etc. Cephalosporin antibiotics are commonly used for surgical prophylaxis. First generation cephalosporins. They possess generally excellent coverage against most gram-positive pathogens and variable to poor coverage against most gram-negative pathogens. In second generation cephalosporins, in addition to the gram-positive spectrum of the first generation cephalosporins, these agents have expanded gram-negative spectrum. Example, cefaclor. Third generation cephalosporins, they have much expanded gram-negative activity. However, some members of this group have decreased activity against gram-positive organisms. They have the advantages of convenient administration, but they are little bit expensive. Fourth generation cephalosporins. They are extended spectrum agents with similar activity against gram-positive organisms as first generation cephalosporins. They also have a greater resistance to beta-lactamase than the third generation cephalosporins. Many fourth generation cephalosporin can cross blood-brain barrier and are effective in meningitis. Fifth generation cephalosporins used to treat MRSA, penicillin resistant staphylococcus pneumonia, Pseudomonas, and Enterococci. Cephalosporin side effect nausea, vomiting, and mild stomach upset. Appropriately 5 to 10% of patients with allergic hypersensitivity to penicillin will also have cross reactivity with cephalosporins. Cephalosporin antibiotics are classed as pregnancy category B. Carbapenems, a class of beta-lactamate antibiotics with broad spectrum of antibacterial activity, highly resistant to most beta-lactamase, active against both gram-positive and gram-negative bacteria, with the exception of intracellular bacteria such as chlamydia, agents such as imipenem, etc. Adverse effect to carbapenems includes headache, rashes, gastrointestinal upset, hypertension, C-section patients with renal dysfunctions, etc. Monobactams, they are beta-lactamase compound. They work only against aerobic gram-negative bacteria. The only commercially available monobactam antibiotics is azithromycin. Adverse effects to monobactams can include skin rashes and some abnormal liver failure functions. Macrolides. Macrolides are bacteriostatic by binding with bacterial ribosome to inhibit protein synthesis. Macrolides antibiotics are used to treat respiratory tract infections, gastrointestinal tract, and infections such as present in the skin. Macrolides antibiotics are erythromycin, clarithromycin, azithromycin. Macrolides side effects nausea, vomiting, diarrhea. These are the common side effects of macrolides. And macrolide antibiotics should be used with precautions in patients with liver dysfunctions. Pregnancy category B drugs are azithromycin, erythromycin. Pregnancy category C drugs are clarithromycin. Aminoglycosides. The aminoglycosides are bactericidal and work by stopping bacteria from making proteins. Aminoglycosides antibiotics are used to treat infection caused by gram-negative bacteria. Aminoglycosides may be used along with penicillin or cephalosporin to give a too prolonged attack on the bacteria. Since aminoglycosides are broken down easily in the stomach, they cannot be given by mouth and must be injected. Generally, aminoglycosides are given for the short time periods. Aminoglycoside group includes amikacin, gentamicin, neomycin, streptomycin, thromycin, etc. The side effects which occurs in the administration of aminoglycosides are ototoxicity, nephrotoxicity, and aminoglycosides are classed as pregnancy category D drugs. Fluoroquinolones. They are synthetic antibiotics not derived from bacteria. Fluoroquinolones are broad spectrum bactericidal drugs that are chemically unrelated to the penicillins or the cephalosporins. Fluoroquinolones inhibit bacteria by interfering with their ability to make DNA. This effect is bactericidal. Because of their excellent absorption, fluoroquinolones can be administered not only by intravenous but also it can be administered by orally. Fluoroquinolones are used to treat most common urinary tract infections, skin infections, and respiratory infections, etc. Fluoroquinolones group include ciprofloxacin, levofloxacin, norfloxacin, ofloxacin, etc. The side effects which occurs when the administration of fluoroquinolones are nausea, vomiting, diarrhea, abdominal pain, etc. Irreversible damage to central nervous system. These are the common side effects of fluoroquinolones administration. And the fluoroquinolones are classed as pregnancy category C drugs. Trimethoprim, sulfamethoxazole, and cotrimazole classifications, and antibiotics used in the treatment of a variety of bacterial, fungal, and protozoal infections. Cotrimazole is generally considered as bactericidal, although its components are individually bacteriostatic. Its action are antifolate in nature, inhibiting both de novo folate biosynthesis and metabolism. Cotrimazole side effects, nausea, vomiting. These are the common side effects when administration of cotrimazole. An allergic reaction and infections with Clostridium, a type of diarrhea. Clotrimazole is classed as pregnancy category C drugs. Some state it should not be used during breastfeeding, while others say it's okay. Tetracyclines, broad spectrum bacteriostatic agent and work by inhibiting the bacterial protein synthesis. Tetracycline may be effective against a wide variety of microorganisms, including amoebic parasites, etc. Tetracyclines are used in the treatment of infections of the respiratory tract, sinus, middle ear, urinary tract infections, skin, and some intestines infections, etc. Tetracyclines are also used to treat Rocky Mountain spotted fever, typhus, etc. Their most common current issue in the treatment of moderately severe acne, etc. Tetracycline antibiotics are tetracycline, doxycycline, minocycline, oxytetracycline, etc. Tetracycline side effects, cramps or burning of the stomach, diarrhea, sore mouth or tongue. These are the common side effects. Sometimes it causes skin photosensitivity and it causes allergic reaction. Tetracycline antibiotics should not be used in children under the age of 8 and especially during periods. Tetracycline are classed as pregnancy category D drugs. Use of during pregnancy may cause alteration in bone development. Chloramphenicol. Chloramphenicol is a bacteriostatic drug. It is considered a prototypical broad-spectrum antibiotic alongside the tetracyclines, and it is both cheap and easy to manufacture. It is frequently an antibiotic of choice in the developing country, effective against a wide variety of gram-positive and gram-negative bacteria, including most anaerobic organisms. Due to resistance and safety concerns, it is no longer a first-line agent for infections in developed nations, with the notable exception of topical treatment of bacterial conjunctivitis. These are the classification of antibiotics. And thanks for watching this video.